Good morning, dear students. Today, I would like to teach you about economic evaluation in healthcare. I am Dr. Makala Gandhi, Assistant Professor of Economics, Sacred Heart College, Tirupattur. Dear students, what is meant by economic evaluation? In particular, healthcare. Let me give you the meaning of economic evaluation. Economic evaluation is the process of systematically comparing the costs and benefits of different healthcare interventions or programs that determine most effective or efficient use of resources. It helps in decision making process in order to provide the best value for money by evaluating both the financial cost and best outcomes in healthcare. What is the importance of economic evaluation? Here we have three important points to be remembered as part of importance to economic evaluation. The first one is resource optimization, where economic evaluation ensures healthcare resources that are allocated efficiently to maximize patient benefits. The second one is informed decisions, under which it provides data-driven insights to support decision making around new treatments, technologies, and the policies. The third one is value-based care. Under this, economic analysis aligns with the shift towards value-based healthcare that prioritizes outcomes and cost effectiveness. So these are the very important points that can come under significance or importance of economic evaluation. What are the types of economic evaluation? There are several types of economic evaluations like cost benefit analysis, cost effectiveness analysis, cost utility analysis, cost minimization analysis, cost consequence analysis. So likewise there are different types of economic evaluation. Here on the screen we have cost effectiveness analysis. What does it say all about? It compares the cost and health outcomes that determine their value per unit of effect. In other words, it compares two or more interventions to their health outcomes, often measured in natural units like years of life saved or cases prevented. Then what is cost utility analysis? It is also similar to cost effective analysis but uses quality adjusted life years or disability adjusted life years to measure health outcomes, capturing both the quality and quantity of life. Then we have cost benefit analysis. What is this cost benefit analysis? What does it say all about? It compares the cost and benefits of an intervention, both expressed in monetary terms. And we have also cost minimization analysis and cost consequence analysis. Cost minimization analysis is used when the outcomes of intervention are known to be identical, focusing only on comparing cost. What about the last one, cost consequence analysis? It lists out all the costs and consequences of different interventions without aggregate to a single outcome measure. So economic evaluation is essential for making informed choices in healthcare, especially when resources are limited and there are multiple competing demands. And you can see here on the screen cost effectiveness analysis, wherein we study about identifying the costs, measuring its outcomes, and finally calculating the ratio between costs and outcomes. This is what we call cost effectiveness ratio. Then move to cost utility analysis. That is what we have just before discussed, cost utility analysis, CUA, wherein we study about quality adjusted life years, QALYS. It measures the value of health intervention based on the quantity and quality of life that it provides. The second one, preference based measures. It captures always patient preferences and values associated with the different health states using tools like EQ and etc. We have another important aspect of cost utility analysis is incremental cost utility ratio, where it calculates the additional cost for QALY, that is quality adjusted life years gain, allowing for further comparison between different interventions. Next we have willingness to pay threshold. It determines the maximum cost per quality adjusted life years society is willing to pay for new intervention. This is something about cost utility analysis. To cost benefit analysis. What does cost benefit analysis speak all about? It compares the cost and benefit of any intervention, and it is always expressed in monetary values. Under this, there are three important aspects that we have to go through and remember. The first one is identifying cost. Under this, all resources used for intervention, including direct medical costs and indirect costs like productivity losses. All these costs must be identified. Then the second step is assign monetary values. It quantify the benefits of the intervention in monetary terms, such as lives saved or productivity gained. And the third one is calculate net benefit. It determines the difference between the monetized benefits and costs to assess the overall value of the intervention. Next, challenges and limitations. Here we have three important points to be recalled. Okay, the first one is data availability. See here, reliable cost and outcome data may be difficult to be obtained, especially for new or complex interventions. So there is a limitation of data availability or maybe lack of available data. The second one is perspective differences. See, evaluations can vary depending on the stakeholders' perspective. For example, patient evaluation may differ. Okay, then providers evaluation may be different. Okay, so here evaluations can change or vary from one stakeholder to another stakeholder and their perspectives. Moving to ethical considerations. Under this, placing monetary value on human life and health can raise ethical concerns around equity and access. So these are the challenges and limitations that we find in healthcare system. Coming to the innovative methods. So what are those things that we are going to find in the near future or upcoming years? Okay. First one is innovative methods. Today we find continuous advancements in data analysis and progressive changes that are leading to modeling techniques which may enhance economic evaluation so rapidly. Then interdisciplinary collaborations. Here integrating economic expertise with the clinical, okay, epidemiological and patient reported data to improve decision making. Then the last one is the patient centered approach. It is very important in the process of evaluation, economic evaluation, where incorporating patient preferences and values to ensure economic evaluation align with their needs and priorities. So this is something that is very important and needed in the part of economic evaluation. So with this, I wind up today's session, and when we come back in the next session, we'll come up with the upcoming topic. Till then, we'll take care. Thank you, dear students. Thank you so much.